Hey everyone, this is Carrie Anderson. Hope you all doing well. In today's video, I'll talk about what are the other types of diabetes. So if you like the video related to my health, my way, I would like to request you all please to subscribe the channel, hit the bell icon or give thumbs up so that I will come up with more and more videos with lots and lots of information. So here we begin. Let's go. Now, what are the other types of diabetes? The first one which comes the gestational diabetes. Diabetes can occur temporarily during pregnancy and reports suggest that it occurs in 2% to 10% of all pregnancies. Significant hormonal changes during pregnancy can lead to blood sugar elevation in genetically predisposed individuals. Blood sugar elevation during pregnancy is called gestational diabetes. Gestational diabetes usually resolve once the baby is born. However, 35% to 60% of women with gestational diabetes will eventually develop type 2 diabetes over the next 10 to 20 years, especially in those who require insulin during pregnancy and those who remain overweight after their delivery. Women with gestational diabetes are usually asked to undergo an oral glucose tolerance test about 6 weeks after giving birth to determine if their diabetes has persisted beyond the pregnancy or if any evidence such as impaired glucose tolerance is present that may be a clue to a risk for developing diabetes. Now it comes this secondary diabetes. Secondary diabetes refers to elevated blood sugar level from another medical condition. Secondary diabetes may develop when the pancreatic tissue responsible for the production of insulin is destroyed by disease, such as chronic pancreatitis, inflammation of the pancreas by toxins like excessive alcohol, trauma, or surgical removal of the pancreas. Then it comes to hormonal disturbances. Diabetes can also result from other hormonal disturbances such as excessive growth hormone production and Cushing syndrome. In acromegaly, a pituitary gland tumor at the base of the brain cause excessive production of growth hormone leading to hyperglycemia. In Cushing syndrome, the adrenal gland produce an excess of cortisol which promote blood sugar elevation. Then it comes to medication part. Certain medication may worsen diabetes control or unmask latent diabetes. This is seen most commonly when steroid medication such as prednisone are taken and also with medication used in the treatment of HIV infection, which is AIDS. Now, what kind of doctors treat diabetes? Endocrinology is a specialty of medicine that deals with hormone disturbances, and both endocrinologists and pediatric endocrinologists manage patients with diabetes. People with diabetes may also be treated by family medicine or internal medicine specialists. When complications arise, people with diabetes may be treated by other specialists including neurologists, gastroenterologists, ophthalmologists, surgeons, cardiologists, or others. Now, how is diabetes diagnosed? The fasting blood glucose sugar test is preferred way to diagnose diabetes. It is easy to perform and convenient. After the person has fasted overnight at least 8 hours, a single sample of blood is drawn and sent to the laboratory for analysis. This can also be done accurately in a doctor's office using a glucose meter. Normal fasting plasma glucose level are less than 100 milligrams per deciliter. Fasting plasma glucose level of more than 126 mg on 2 or more tests on different ways indicate diabetes. So a random blood glucose test can also be used to diagnose diabetes. A blood glucose level of 200 mg or higher indicate diabetes when fasting blood glucose stays above 100 mg, but in the range of 100 to 126 mg, this is known as impaired fasting glucose. While patients with IFG or prediabetes do not have the diagnosis of diabetes, this condition carries with its own risk and concern and is at risk elsewhere. So that's all about the diabetes in this video. I hope you all liked it. And one thing more I need to mention, I personally prepared a small presentation for all of you guys that the link will be shared in the description box below, and I'm sure 100% that will be going to help you in order to overcome your diabetes. So go forward and look that video first. And before signing off, I would like to request you all please to like, share, subscribe this video with your loved ones so that they can also gain their knowledge about this. So that's all. We'll come up in the next video with another content. Till then, God bless you all. Bye bye. Take care.